Hello everyone from the WHO Regional Office for Europe in Copenhagen. My name is Rami Sroor, and we're here today to mark an important day, Universal Health Coverage Day. But this is a special UHC day. 2 years into an unprecedented pandemic, WHO Europe is marking this day with a spotlight on health workers. Doctors, nurses, physiotherapists, social workers, midwives, all health workers. This is a topic that's very dear to our hearts here at the World Health Organization. It's also a topic that's become a burning issue in all the 53 countries in our region. COVID-19 has really highlighted how important our health workers are. They're the pillar, the backbone of our health systems. And the pandemic has brought home the message that we need to care for them, to protect them, to protect their mental health and invest in them. We're joined today by the WHO Regional Director for Europe, Dr. Hans Kluge, and by our Director for Health Systems and Policies, Dr. Natasha Azzopardi-Muscat. Hans and Natasha, thanks for being with us. Today we're going to hear from the health workers themselves, sharing their stories, their challenges, their hopes, and their aspirations during this unprecedented period in their lives. We'll be traveling across our region to Denmark, Malta, and Lithuania to hear what health workers have to say and understand how we at WHO and how governments across our region can better support them. But before we hear from them, Hans, allow me to come to you for some opening words.
Thanks, Rami. This is a really special day for us here at the WHO Europe. And yes, as you say, this is a topic very dear to my heart. I have been there. I have spoken to health workers across the region, and they have shared with me what they are going through. This is an unprecedented time in our lives, but it's also a time where we have the chance to understand what really counts and what needs to be fixed. We know that things were not easy for the health workforce before the pandemic, but COVID-19 has brought things to the surface. I've been speaking to ministers, to governments about the need to protect our health workers. And as we prepare to go through what will clearly be another tough winter in Europe and Central Asia, I have 3 main messages to share. First, we need to provide mental health support to all health workers. And what does it mean in practice? It means that we should include a mental health focal point in all healthcare facilities, someone who is there for the staff themselves. It also means that we need to ensure health workers have a proper work-life balance. They have been under tremendous stress, with many of them facing burnout. This can be prevented if we have the right systems in place, such as staff rotation, shift breakdown, and so on. Second, we need to prioritize the vaccination of all health workers. They should be a priority group, and we need to make sure we give them all the necessary information about vaccines so that we avoid pockets of unvaccinated health workers in our health facilities. And third, we need to pay health workers decent wages. Most of them, if not all, are working overtime, especially during infection peaks. This time needs to be compensated properly so that they remain motivated, engaged, and feel that they are valued for their work.
Thank you, Hans. Indeed, these are very important points, and we hope that we can take them with us also beyond the pandemic. Natasha, you also have first-hand experience as a medical doctor in Malta, and now you oversee a department here at WHO that oversees the work of health workers and how we can support them. Over to you.
Thank you, Rami. I think we're at a turning point in the way we see our health workers and how they contribute to universal health coverage. Health workers are really the cornerstone of our health systems, and without them there's no health. It's that simple. In addition to the points shared by Hans, I think it's also important for us to recognize the value, efforts, and commitments of health workers during this pandemic. In the first months, we saw people clapping for them and cheering from balconies. That was great, but we now need to move on to the next stage where we actually do something about it. We need to see actions of public recognition from governments, and also to encourage health workers themselves to speak about their experiences, the tough times and the beautiful moments too. And this is what we are trying to do here today. We also need to think about what happens afterwards. We don't want to leave behind those who stepped up during our time of need. And now is the time to think about how we can make working in the health sector more attractive, focusing very much on the importance of work-life balance, a factor which has become very important during this pandemic. And I am optimistic. I am optimistic because I know from the important work in our region supporting health ministries that they too share our concerns and are seeking to really shift the thinking and start investing more in our health workers. We know we can do it. Now we just need to get to work.
Thank you, Natasha, and thank you, Hans, for those inspiring words and for those reflections. You probably don't hear about them very often, but they're doing extremely important work behind the scenes. Social workers. Social workers provide long-term care to vulnerable people in their homes, and these are people who cannot leave their homes because of disability or old age. So social workers bring the care to them. And of course, the pandemic has made things a little bit more complicated. In Denmark, older people receive care in their own houses because the country abolished nursing homes back in the 1980s. The focus there is on improving the strength, the confidence, and the independence of the older people in their own homes. We've connected with Søren Brostrøm, who is the Director General of the Danish Health Authority. And here, Søren meets with Christina, a social worker in the Copenhagen area. Christina walks us through her work and some of the challenges she's faced over the past 2 years. Let's hear from them.
Hi, my name is Søren Brostrøm. I'm the Director General of the Danish Health Authority. And all through this COVID-19 pandemic, me and my team have been at the forefront of controlling the epidemic here in Denmark. We've been advising government on face mask requirements, test requirements, lockdowns, etc. We have been issuing guidelines, communicating to people, and also we have been in charge of the national planning of health capacity. I think some of the most important work though during the pandemic has been the people and professionals at the forefront. Doctors and nurses working in hospitals with intensive care, family physicians seeing patients, physiotherapists doing rehabilitation of COVID-19 patients, and midwives helping mothers delivering babies. Today I'm visiting here in Frederiksberg Kommune with some of the social workers who have been very important in taking care of the elderly persons during this COVID-19 pandemic.
Hej Christina.
Hej Søren.
Tak fordi du har lyst til at snakke med mig.
Jamen jeg startede faktisk her i huset for 15 år siden som ufaglært. Og så blev jeg uddannet hjælper, og så var jeg på plejehjem i rigtig mange år. Men jeg brænder for at køre hjemmeplejen, så jeg startede som aftenvagt der.
Så du brænder simpelthen for at køre hjemmeplejen?
Ja.
Rundt til borgerne?
Ja.
Hvorfor det?
Jamen fordi jeg synes, der er en frihed i at køre rundt fra sted til sted, i stedet for at man er låst fast på et plejehjem, på en afdeling, hvor man... altså rigtig mange på et plejehjem er jo demente. Og det skal man brænde for at arbejde med, ellers så det kan de jo mærke, at man ikke er der. Vi har jo rigtig mange dispenseringer.
Altså medicin, der skal...
Ja, hvor vi hælder medicin op for folk, fordi det kan de ikke mere. Og vi har jo rigtig mange, som så egentlig er selvhjulpne, så vi kommer jo bare en gang hver 14. dag og kigger og får hældt deres medicin op. Og så har vi sovepleje og operationsbehandlinger.
Så her under coronaen, har det så været hårdere at lave dit arbejde?
Altså, ja, det har det jo, fordi at der har været en afstand til vores borgere, som vi ikke har haft tidligere. Vi kunne pludselig ikke komme tæt på, så når de var kede af det, og de var jo også ramt af ensomhed.
Ja.
Altså det med at sidde og holde i hånden og lige give kram, det har vi ikke kunnet. Så på den måde har det været hårdt. Og så har det også været hårdt i og med, at vi har jo været delt op i vores mødesituation. Der har vi ikke kunne være inde alle sammen, så der er gået rigtig meget tabt, kan man sige. I og med, at vi ikke mødes med vores hjælpere. For det er dem, der kender vores borgere allerbedst. Så når vi skal ud i et hjem, så er det som regel dem, vi ligesom spørger, hvad er det? Altså, hvem er fru Jensen? Og det har vi ikke rigtig kunnet. Så jeg vil sige, vi har også været... Altså, vi har måttet skulle finde nye veje for ligesom at bevare vores faglighed.
Ja, det forstår jeg godt.
Og mødesituationer har også været svære, fordi det skulle foregå via Teams og Skype og hvad vi nu har haft. Ikke? Altså hvis vi skal nå nogle veje med vores borgere, så er vi jo nødt til at have den relation.
Det er klart.
Også fordi vi har rigtig mange demente også.
Ja, det er klart, ja.
Jeg er også glad for at se dig.
Og nu skal du ikke blive ked af det.
Nej, og jeg har slet ikke haft det sjovt.
Nej.
Har det så under coronaen været hårdt? Altså har I haft meget smitte blandt personalet eller mellem jer og borgerne?
Nej, jeg synes ikke, at vores borgere har været så hårdt ramt, som man kunne have forventet, fordi vi har været rigtig gode til at passe på.
Ja, med værnemidler og afstand og håndsprit selvfølgelig. Ja. Hvad har været det allerhårdeste for dig og dine kolleger her under coronapandemien?
Ja, hvad har det været det hårdeste? Jamen, jeg tror faktisk, at det har været det der med, at vi har jo, altså den afstand, vi har holdt, vi er jo meget sociale. Ja. Og også med vores borgere. Og den afstand og ikke kunne hjælpe på, altså mere end vi har kunnet ude i hjemmene, men også med hinanden. Det tror jeg har været det hårdeste.
Ja, det forstår jeg godt.
Ja.
Christina, her under corona har der været sådan en helt særlig begivenhed, hvor du virkelig tænkte, yes, det giver mening for mig i det her fag, det vil jeg gerne blive i.
Det er jo et givende job, så det oplever vi hver dag, men for ikke så lang tid siden var jeg hos en dame, hvor jeg kommer op. Vi kommer der sådan hver 14. dag og hælder hendes medicin op, og hun er så faldet. Og sidder på gulvet og er helt ulykkelig, og jeg kan ikke få hende op selv, så jeg ringer over efter vores sygeplejerske, som kommer med... Altså, vi har sådan puder, vi løfter dem op på. Ja. Og det viser sig jo så, at hun faktisk har brækket sin hofte, og jeg må insistere på, at hun bliver indlagt. Og hun er så lige kommet hjem. Ja, det var jo heldigt, at jeg lige kom på det tidspunkt, for ellers så kunne hun jo sidde længe. Og det er jo også fordi, jeg havde den relation til hende, jeg godt var klar over, den var jo helt galt, at gå og se på bilen. Så jeg glæder mig til at skulle ud og se hende igen her.
Hej.
What an amazing and important service that is. Natasha, what do you think?
I was really struck by the dignity and independence that Christina brought to her patient in this video. You can really see that she is passionate about the patient. This is not just about providing a treatment or medicines, it's about the relationship that they build with the people. And I'm happy that through this video we have been able to give visibility to all those health workers out there who are providing care to people in their homes. This is really about access to health and well-being. And also, I think she was very attentive, for example, to infection control measures. And to me, it's really about the fact that all these workers who work with people in their own homes need to combine a very high level of clinical expertise because they are on their own, making decisions, not with the supportive environment that you find in a hospital, but also that they need to have very good listening skills, patience. Basically, they need to have a large amount of physical and emotional strength.
Of course, and this is a very good segue to our next story, our two nurses from Malta. Nurses are very good listeners. They're with patients day and night, listening to their needs, to their ailments, but they're also good listeners because they know and they understand their communities. Here, we'll hear now from Rachel and Jürgen, two nurses at Mater Dei Hospital in Malta. Rachel works in the infectious diseases unit, and she's been working with COVID-19 patients since the pandemic started. And Jürgen runs the hospital's vaccine program. Let's hear their story.
Hello and greetings from Mater Dei Hospital in Malta. I'm Natasha Tsopardi Muscat and I'm here today with two of our nurses, Rachel and Jürgen.
I'm a nurse working at the infectious diseases unit for the past 7 years. Mainly the COVID experience has been a challenge where we saw a lot of patients suffering from the coronavirus. Patients that are away from their families for a long period of time due to their recovery. And basically our main aim as a ward, we try to make a better experience for these patients in order for them to get better and feel more welcome and at home in our ward.
My name is Jürgen Sunes. Currently I'm taking care of the vaccination rollout along with my team. We take care of ordering vaccines, planning appointments, sending appointments to clients. This needs a lot of preparation. I mean that we need planning beforehand. We need to order vaccines from CPSU. CPSU have to have these vaccines in stock so that they can supply us and supply our clinics. We need to order and book nurses accordingly so that they can help us vaccinate. And as well as the registration team so that when they come, they find the whole setup. We started with the immunosuppressed persons. We continue to the over 70 years old clients. And then healthcare workers and educators followed, continuing going down by age according to their ages. To capture those people that literally are still hesitant to take the vaccine is quite a challenging job for us. The thing is, we want them vaccinated, not just to reach the 100% vaccinated population. We want to capture these clients, these hesitant people, just for their own health, for their own sake. Currently, as you know, we're having deaths everywhere in the world due to COVID. So to protect children, to protect the vulnerable, and especially the immunosuppressed, everyone needs to take the vaccine. My job is try to explain to them the benefits versus the risk of the vaccines. And obviously, the benefits, they always are much higher than the risk, because mostly these clients, they have fear of the unknown. They are exposed to social media data that is not correct. So what happens is they be afraid to take the vaccine. So I try to overcome their fear, and by explaining to them step by step what the vaccine consists of, what they might experience, side effects that, you know, everyone might experience some side effects.
The most challenging moments were when these patients weren't getting any better, basically, and we saw them deteriorate day by day. And at times we did everything we could, but still they were deteriorating. And at one point the situation was getting out of hand. We were having a lot of admissions, and the work was getting hectic every day. Patients being transferred to more acute care, intensive care. That was a challenge. It's very tiring, especially the mask. The mask has to have a tight fit so that we're safe and covered. And basically, it's even about our emotions. Like when we have normal patients, we can express ourselves, we can smile, the patients can see us laugh and everything. With the personal protective equipment, the patient will just see our eyes. So no emotions, he cannot recognize that this is this particular nurse who came to help me this morning. And it's very tiring, basically, and obviously we had to exchange between us and have breaks in between. You cannot stay a whole day with personal protective equipment because it's very hard.
If I had to ask you to pass on a message to perhaps some young people who may be considering a career in nursing but are not sure, what would your message to them be?
My message obviously would be that nursing is not an easy profession, but at the end of the day, after a shift, you go home and you say, I've made a change in people's lives. I have helped people I'm offering a service also to my country because we're on the battlefront of this pandemic. It's very rewarding and very satisfying at the end of the day. What has kept me going? I think my colleagues, our teamwork got better with COVID-19. Support from all the multidisciplinary team, the doctors, the physios, the carers, the cleaners, everyone. And also my family, my relatives. I mean, this wasn't easy for them. They were also afraid that I would get COVID or, you know.
By the end of the day, when you go home, you can say that you save life. Saving lives in this modern world and this modern, medical world is really job satisfying. Healthcare workers face a lot of difficulties especially during this pandemic. But when you feel recognized, when you feel respected by the community, especially when we are seeing them coming for the vaccines, they are believing in science, they are believing in us. That's quite really rewarding for our profession.
Okay, so now that was interesting, wasn't it? I think we saw a lot there. I think we saw two ends of the spectrum of care. On one end, we saw the darkest moments of this pandemic. But on the other end, we saw our way out, these life-saving vaccines. And of course, we saw the pride in Rachel's and Jürgen's eyes. Hans, what do you think?
Well, first and foremost, Remy, I have to say that I share the pride that Rachel and Jürgen are feeling, and they should be really very, very proud. In fact, as you say, they have been there during the most tough moments with the people in the red zone, not knowing whether they will be able to make it, but also more broadly, talking to the larger community, sharing information, which is so important in these moments that people have so many questions and really an infodemic. I see a lot of empathy, but also a comprehensive professional approach. For example, a meticulous planning and preparation, mentoring of the peers of the younger incoming workforce. What I would say, I see this, that the nurses in Malta and globally are providing a heroic service, first to the community, to their country, but also to their families. In that sense, I would say there are millions and millions of Rachels and Jürgens in the world, and the governments, the World Health Organization, should really join efforts to make the nursing profession, the midwifery profession, the profession of all health workers as attractive as possible for younger generation, because the world needs them.
Absolutely, Hans. Very well said. Let's now move to another aspect of the workforce, contact tracers. Contact tracers are the disease detectives, epidemiologists, public health specialists. They work to understand where the cases are and how the infection is developing. Sometimes we see them on TV, but in real life, they work behind the scenes to understand how we can keep our societies open and safe. We'll hear now a story from Kaunas, Lithuania's second largest city, where our colleague Martynas has connected with a young contact tracer in the city. Martynas, over to you.
Sveiki visi, linkėjimai iš Lietuvos. Čia esame kartu su Gintarė, kuri yra visuomenės sveikatos specialistė ir šiuo metu dirba kaip atvejų tyrėja. Atvejų tyrėjai atlieka itin svarbų darbą, naudoja duomenis ir modelius, kad suprastų, kaip liga plinta.
Sveiki Martynai, esu Gintarė Pilvelytė, man 29 metai, dirbu Nacionaliniame visuomenės sveikatos centre. Čia pradėjau dirbti 2019 metais ir beveik dirbu 3 metus. Aš esu visuomenės sveikatos specialistė ir kiekvieną dieną atlieku kelias dešimtis epidemiologinių tyrimų, siekdama atsekti užsikrėtusiųjų kontaktus ir taip užkirsti kelią viruso plitimui. Kiekvieną rytą aš iš Jonavos keliauju į kitą miestą, į Kauną, kur dirbu. Mes pajuokaudami su kolegomis dažnai save pavadiname COVID-19 ligos detektyvais. Būna sunkumų atsekant sąlytį turėjusius asmenis, nes sergantieji dažnai neįvardyja savo kontaktų, nepasako renginių, kuriuose dalyvavo. Tai kartais mūsų darbą tai apsunkina. Klausimai būna patys įvairiausi, bet dauguma klausimų yra susiję su izoliacijos laikotarpiu. Žmonės klausia, kiek jam laiko reikės izoliuotis, ar vakcinacija padės jam apsisaugoti nuo sunkių ligos formų.
Taip pat susidorojate su protrūkiu valdymu konkrečiose vietose, pavyzdžiui, darbo vietose. Koks pagrindinis jūsų tikslas atliekant šios tyrimus?
Yra lokalizuoti ir sustabdyti protrūkio plitimą įmonėje. Mes susisiekėme su įmonės atstovais, teikiame jiem rekomendacijas, padedame tas rekomendacijas pritaikyti praktikoje, surinkti didelės rizikos sąlyčius, mažos rizikos sąlyčius. Esant poreikiui, siunčiame darbuotojus testuotis ir teikiame visą kitą metodinę informaciją, kuri yra aktuali įmonės atstovams ir patiems įmonės darbuotojams. Labiausiai man patinka rezultatai, kai matau, kad pavyksta suvaldyti protrūkį, užkirsti kelią viruso plitimui, bet čia didžiausia darbą ir didžiausias pastangas įdeda patys žmonės, kurie sąžiningai vykdo visas rekomendacijas ir stengiasi suvaldyti kartu su manimi protrūkius. Nežinomybė. Pačioje pradžioje buvo labai sunku, kai tu nežinai, kas bus rytoj, po pusmečio, po metų. Vėliau atėjo neviltis, nes buvo labai daug COVID-19 atvejų ir mes jau nesugebėjome jų ištirti. Kad norėčiau nebejausti nuovargio darbe. Norėčiau, kad vieną dieną nebebūtų COVID-19 pandemijos. Aš suprantu, kad žmonės labai pavargo nuo COVID-19 pandemijos, nuo apribojimų, nuo nuolat besikeičiančios situacijos, bet matau ir kitą pusę šios pandemijos. Matau žmonės, kuriuos COVID virusas palietė per daug stipriai. Pandemijos pradžioje mūsų kolegos labai aktyviai teikia informaciją socialinėse medijose. Praktiškai vos ne kiekvieną dieną kolegos teikdavo informaciją apie COVID-19 situaciją Lietuvoje. Dezinformacija darbą apsunkina labai stipriai, nes pačioje pradžioje buvo, kad žmonės tiesiog neigdavo COVID-19 ligos, kad yra labai svarbu informaciją teikti visuomeniai, kad yra svarbu ne vien pateikti abstrakčius skaičius, bet ir parodyti, kaip atrodo darbo vieta tų pačių visuomenės sveikatos specialistų, gydytojų, kaip atrodo jų kasdienybė, kaip atrodo žmonės, kurie išgyveno tą ligą.
Natasha, those were some interesting and inspiring words from young Gintare, also about the future of contact tracing. You were Chief Medical Officer in your home country of Malta, and I know that public health is very close to your heart. What can you tell us about the future of contact tracing?
Contact tracing has been at the heart of our efforts of the public health workforce in order to keep this pandemic under control. Through contact tracing, we try not only to keep up with the virus, but to keep a step ahead. Because when we make contact with the contacts of the identified cases, a risk assessment takes place to identify the need for testing, isolation and quarantine. And sometimes, Rami, these are very difficult conversations that have to be had in a confidential type of interview setting. And we do know that our contact tracers have been at the other end of the telephone line when people were given the news that they have been in contact with a case, the anxiety that this provokes not only about their own physical safety, but also what does isolation or quarantine mean in terms of loss of earnings, for example. They have really heard the despair. And they have been very important to give us feedback, not only to tell us actually which are the largest causes of spread contributing to fueling and triggering where the virus is going, but also to provide us important feedback, for example, about the mental health and well-being of the wider population. And I think it's really important that we document case studies from contact tracing and we capture this experience also as we go forward.
Thank you both for sharing your thoughts and reflections on the importance of supporting our health workers. And of course, thanks to our health workers all over the world who are keeping us safe during these challenging times. I think we're privileged to have with us here a group of health workers joining us live on Zoom from across our region. And Hans, I know there's something special you'd like to say.
Absolutely, Remy. And I would like to thank everyone who joined us. It's the first time that the WHO Regional Office for Europe and Central Asia is handing this award here in front of me for the health and care workforce, for your tremendous professionalism, empathy, dedication, and that of your families. There is no universal health coverage, no health without health and care workforce. I am going to send this award, one to each of the 53 Ministers of Health in our region, with the appeal to step up our collaborative efforts to nurture, to grow the health and care profession, so that you have the best possible circumstances to perform your heroic job. Thank you so much. Spasibo vam bolshoye.
And now thanks to both of you, and of course thanks to all of you for joining us today and for being with us during this event. Stay safe, stay healthy, and protect your health workers.